This video looks at how suicides in the U.S. are increasing at an alarming rate. People commit suicide for a number of different reasons, but in nearly all cases, they leave their families and friends in despair, bewilderment, and regret. What if we'd done this for the person or done that? Would they still be alive? In the cases of young people and teenagers, sometimes there are no really good answers. Suicide seems to be touching more and more of our lives. A recent Centers for Disease Control study confirmed that suicides are rising in the U.S. It now is one of the leading causes of death. Rates of death from suicide have risen by roughly 25% over the past 2 decades. In 2016, there were 44,965 recorded suicides, up from 42,773 back in 2014. Though the reasons for suicide increase is not totally clear, experts have their own ideas. An increased sense of loneliness and isolation by Americans. Many families live large distances from each other. Another could be that in urban areas there is not as much face-to-face contact with friends, neighbors, and relatives as there once was. Increased mental illness, such as depression. In another CDC study, it found that more than half of suicide deaths happened among people that weren't diagnosed with mental illness. Had mental illness been discovered among that group, the statistics would actually be much higher. Technologies such as social media. Recent studies have found that extended use of social media can cause many people to experience negative mental health outcomes. There can be the distracted attention from using multiple social media outlets and also the emotional results of having a negative online experience. Using these multiple platforms such as Facebook, Twitter, Instagram, Snapchat, Pinterest, and others when used together can more easily bring about depression and anxiety among young adults. One possible reason for this is that using different platforms at once causes multitasking. Studies have shown that multitasking across social media causes poorer attention, cognition, and mood. Persons using multiple platforms are associated with more anxiety just by trying to keep up with the rules and culture associated with each one, and trying not to commit a gaffe because of a divided attention. Drug addiction, such as using opioids. Opioid addiction is a huge problem in the U.S. Some can't or won't get help and stop, leading to hopelessness and despair. Economic factors. Homelessness in the U.S. is actually rising. On the coast, wages are not keeping up with rising costs. Many can't find affordable housing, even if they're working. Once people wind up on the streets and living out of their cars, many fall into despair. Many experts think the aging baby boomers population will be especially vulnerable to suicide in the coming years. This because many have little to no savings and retirements. Also, rising medical costs are putting more into poverty. And there are other alarming trends concerning suicides in other groups. For instance, the suicide rate for white children and teens between ages 10 to 17 went up 70% from 2006 to 2016. A pediatric hospital study in early 2018 found admissions of patients from ages 5 to 17 for suicidal thoughts and actions more than doubled from 2008 to 2015. The group with the highest risk for suicide are white males between 14 to 21. Shockingly, between 1999 and 2015, 1,309 children ages 5 through 12 took their own lives. That means one child under age 13 died of suicide nearly every 5 days. The CDC has discovered suicides of 5, 6, and 7-year-olds. Another recent study found that children of parents who have strong religious beliefs have far less incidents or thoughts of suicide. These children have an 80% lower risk of suicidal thoughts or attempts when compared to their counterparts whose parents place little emphasis on religious importance. As to what can be done to reduce suicides, experts feel that most people could be helped. However, improved treatment options won't help if people won't reach out for assistance when they are at their lowest and hopeless point. In particular, a lot of men have undiagnosed and obviously untreated mental health conditions like depression. Women appear to be better at seeking mental health help. There are often other indicators that additionally compound problems, like propensity to violence or substance abuse. Studies usually say that depression and other forms of mental illness are chronic diseases and require those affected to have to reach out for professional help. Here's a telephone number for the National Suicide Prevention Lifeline, 800-273-8255. Calling allows you to talk to a trained person about your situation. From Indiana, this is H.A. Graves.